So the cause of the death of the Matthew Perry finally has been revealed by toxicology result. And unfortunately, it was due to use some kind of chemical. In this case, it was mentioned about ketamine, but it was not only ketamine. It could have been in combination with some kind of medicine, prescribed medicine that he was taking. So first of all, quick review, what is ketamine? Ketamine is an anesthetic. It's a dissociative anesthetic. It produced and made in 1960s. It had been used in Vietnam War. And nowadays it has different application. For example, it has been used as an antidepressant. And those people who struggling with the addiction for long term, some of them need this as an antidepressant, because one of the long-term struggle that people who've been addicted they will face beside the physical problem is the depression once they are off the drugs. So apparently it was prescribed for Matthew Perry, but the clinical intake of the ketamine that he had took was 7 days before the event. So it has been recorded that he went to the clinic and get the ketamine dosage. But the toxicology result, the amount and the molecules that they have been recovered from the toxicology result, it shows between 3 to 4 hours before the incident. So he must have been used it again by himself or with the help of somebody. And how it been used, we have no idea about it, but unfortunately it could have resulted in this problem. And the things I want to mention here, it was not only ketamine. So ketamine at the lower dosage, it increased the heartbeat, while at the higher dosage, it can totally have a reverse effect. It can reduce the heartbeat at the higher dosage. Plus, Matthew Perry was on another prescribed medicine which called Buprenorphine. And when I read about this medicine, it's basically, it said it's safe, it has no effect on the heart, it has this, it has that. But at the same time, it mentioned there are not much result and research about if you use this medicine with another medicine. So there are sometimes, if you take two different chemicals inside your system, they can have synergistic effect. Synergistic effect means if the outcome of 2 plus 2 should be 4, in this case, it could be 8. Means it will emphasize on what kind of physiological effect it gonna have in your system when you take these two medicine together. And for ketamine especially, it has been mentioned, for example, you should never take it with alcohol. It can has a very fatal effect. So whether he used extra dosage of the ketamine or ketamine plus buprenorphine together cause him to overdose, means he reached the K-hole station. K-hole station is the kind of situation that has been described by people who use too much ketamine. And in this kind of situation, they cannot feel, they feel numb, they cannot understand where they are, what they are doing, and even they lose all kind of sensitivity in their body. So they feel out of body experience. In this kind of state, if they get raped, they get crashed by the car, they cut themselves, or any kind of bad things that happen to their physiologically, they cannot realize and they cannot respond to it. And that's a very dangerous state. And unfortunately, Matthew Perry was in that state when he was in the jacuzzi. So if somebody was with him, there could have been a different outcome. So please be cautious. If you are taking ketamine for any good reason or any bad reason, make sure there's somebody that take care of you. Make sure you do not take other kind of chemicals, especially alcohol, which is already documented, but any other prescribed medicine. In this case, I'm suspicious to the buprenorphine, because there was no study that can indicate does buprenorphine plus ketamine could have fatal result. And if, let's say, there are many research conducted in this, there will be many different outcomes. As there is a paper, I'm gonna post it here on the ketamine, that they did it in a small group, but outcome of the effect of the ketamine on the heart disease, on the heart condition was also varied. So any kind of chemical that you take, It really depends on your physiology, your receptor, your genetic, and your body condition. What will be the outcome of that? On of that, basically what could be the physiological outcome of that intake. So please keep that in mind, stay safe. And I'm still very sad that we lost such a pure and loving soul who was really brought laughter to my generation for many years. And I hope he rests in peace, and I hope this will be a good lesson for rest of us if we have to even get a prescription for taking ketamine or other medicine relevant or other kind of compound relevant to this kind of family. So all the best, please stay safe till next time.